Aye.
Aye.
Okay, all opposed, same sign, minutes are approved. Next, we'll go right into reports, and Ms. Paramore, Mr. George Dyer. Is he here? Or someone in the Paramore? We're checking.
I'm having our folks go check to see if he's waiting in the other place.
Oh, okay.
We'll know in a minute.
Well, we can move on to Cherokee Nation Health Services. Connie Davis, come back to him if we find him.
Well, thank you, and thank you for the invitation to enjoy that delicious lunch. I'll begin by sharing our clinic numbers for the month of September. In Wilma, at Wilma King Mankeller, we saw 10,746 patients. Redbird Smith, 9,699. Salina, 8,223. In Jay, 6,598. In Nowata, 4,318. In Muskogee, 13,941. In Bartlesville, 2,000. In Bonita, 4,927. At the Gadugi Clinic here, 416. And at Hastings Hospital, 29,898. And that's just at 10,000 patient visits more than it was in 2012. We had our medical executive committee meeting this past Thursday, and at that time, Dr. Montgomery and the group, we introduced a new scorecard for our primary care providers. And what this does is it measures quality, it measures patient satisfaction and productivity. This scorecard was developed with input from the medical directors representing each clinic, and they would take the ideas. We started this actually in July, I believe. They go back, they meet with their staff, and they come up with a measurement, if you will, or a tool that will help the providers, set goals to accomplish, and then their bonuses will be based on the high performers there. And we're hoping, we get awards in our quality measures all the time, but we still feel like there's a huge room for improvement in our productivity or the number of patients seen. And so this will be recorded. The clinic numbers were shared with the providers there, and I think overall it was well received. On November the 4th, the chief signed a proclamation naming November National Diabetes Month. There are several events at the surrounding clinics and fundraisers going on in recognition of this month. So far, we've raised $37,000 to contribute to the American Diabetes Association. The Oshaleta or Kuiskui Clinic ground opening will be December the 9th at 11 o'clock. So be sure to put this on your calendars. Bring your boots and a coat, because I'm sure it'll be windy and cold. Right, Councilman Lake? The emergency room and urgent care saw 5,484 patients. The left without being seen rate was 9%, which is not what we want at all. We want to go with 3%. The admission rate is up from the emergency room to 8.43%. The goal is 12%. Now, let me make this clear. We don't want people to be sick. We're not hoping that they're being admitted, but that means those patients are probably being transferred out of our service. So that's lost revenue, and it's an inconvenience to the patient staff to travel. So we're working on that, and I know the hospital staff is reviewing that on a weekly basis, I believe, to see, just to do a second look and see if there are things that we're sending out. And primarily those are cardiology patients and nephrology patients. Transportation services transported 137 patients over 7,000 miles. There were 378 surgical procedures in September. 1,304 dental emergencies. That's a lot of dental emergencies when you think about it. Behavioral health saw 1,286. Jack Brown Treatment Center has 18 patients, and they had their CARF, or their Commission on Accreditation of Rehabilitation Facility survey, and they were found to be 100% compliant in all their standards. That is a tremendous effort led by Darren Dry and his staff. So if you get a chance, you might shoot them an email recognizing them for that great achievement. Pace Center has 124 patients, home health has 130, hospice 20, outreach 552. And just a brief update on 90-day refill in the month of October, we filled 2,797 prescriptions for 90 days. 2,797. Now, we don't know the full revenue impact on that. We'll have to watch to see. Probably January, we'll have a better idea of how that impacts us as far as our revenue. That concludes my report. Any questions?
Yes. Councilman Lane.
Thank you, Madam Chairman. When we talk about transportation of the clinics, or is that Hastings?
It's centralized out of Hastings right now, so that involves several clinics, and I would prefer to be covered
We
the
will
scope.
track, no. Each
So we'll have to
clinic
include
has its
those, Counselor.
And the CHRs that have been needed in a couple of our clinics, have you got a release to hire those yet?
We're still doing an evaluation on any new hires, and I can't speak to if we've hired that and filled those or not, but I can check.
And those report cards, I guess, for providers, are they all the same in each clinic, or just?
They will be.
Thank you. Thank you, ma'am.
Councilman Fisher.
Now, I'm looking to, I told you I was getting reports at Welcome that we don't have enough doctors down there. I've got another report this past month, they went down there, there was just one doctor, one night. I'm getting calls left and right saying there's not enough doctors down there.
Okay. Fill the on the days that you hear there's only one doctor, then we can see if that's a scheduling issue or what that issue is.
I was never seeing an increase in doctors in our clinics. I mean, I heard from, during the pay raise, how this little pay raise was gonna answer all our questions for these doctors, and we're still getting complaints.
Well,
How much has the pay raise done for us, net-wise? By the time we raised up, brought all these extra people on, and then lost our few that we naturally lose, how much are we ahead now? I mean, doctor,
I would have to go back and look at that because it was in February, I believe, that we implemented that.
My answer to the best case, I guess, the number I've always used is the vacancy rate. Again, we started over a year ago, the vacancy rate was 28. For several months in a row, we had a vacancy rate below 10. And unfortunately, it's crept back up, and you can see in the report, the vacancy rate now is 14. So there's I think, been a very positive response to the increase in pay. A number of providers we've hired, but it's a challenge to keep people on board. So I'd still say overall, looking at that vacancy rate, we've done well.
you all have, okay, I'm one of the people that you can always do better, so don't take this wrong. You all have done good. You all can do a heck of a lot better. And we are getting ready to open up clinics and hospitals. And if you all ain't got the doctors, you're getting ready to make me look bad. And you all are not gonna make me look bad, folks. I can do that on my own. I don't need your help.
I want to say too that I think, as Ms. Davis said, the scorecard is one of those tools that we're going to use to not only, we want to get that vacancy rate down as low as we can to keep it. The other thing, waste access, is how many patients doctors are seeing. I think there's some room for improvement, and that scorecard is the way we're going to try to accomplish that.
And that there's a lot of ways, but what it amounts to is all these different ways, whether it's the school card, whether it's we got good doctors, bad doctors, making them see more, going in the rate, giving them whatever, just everything combined. The fact of the matter is, we're building clinics. You don't have no more time. You all do not have no more time to figure out how we're gonna do this. I mean, we're there, folks. We're at the game. And I'm not seeing a comprehensive plan, and I'm not seeing us have these people here. Matter of fact, I'm saying you're almost behind the starting point now. I don't like getting these calls when I am getting ready to get more clinics built. So can you all please come to us next month with a plan that tells me how you all are going to get more doctors in? I think you all's doing great in health. Don't get me wrong. And after I gripe at y'all, tell you all's doing great. But I still want more doctors in there.
So do we.
Okay?
So do we.
And other than that, I think health's doing wonderful. I think we've got our feet under us and we're on the right direction. I really do. But we've got to have doctors. Thank you.
Any more questions, comments? If not, I have a question or comment or whatever. We were discussing several different times here in these committee meetings, extended hours at some of the clinics, and I'm kind of like Councilman Fisher-Hawk, I don't know how we're gonna have extended hours when we don't have enough people to spread around for regular hours. So we're gonna have to hire more, change the schedule. It would be a great blessing to the outlying clinics so far away, especially Redbird is very far away, and the clinics up north, if they had extended hours, and then people are sick and their only alternative is to drive to Telephone. So can you give me a little update if there's any progress being made on that?
Well, Redbird Smith is one, that we have limited positions. We have a lot of mid-levels, and we really have a strong need for providers in that clinic specifically. So we can go back to our recruitment office and ask for that comprehensive plan. That's not an unreasonable request at all. And we need to focus our efforts on those clinics. We have extended hours in Barnesville and at Three Rivers, but those two are the other two big clinics that we have, and it would take a tremendous burden off of the emergency room and urgent care if they were open extended hours. So,
But you can't open until you hire some more people.
right.
That's my problem over at my clinic. My clinic, when they don't see a doctor, or if we've got a limited number there, they come and use Hastings as an emergency room at night. They'll say, well, I don't want to wait here for 3 hours, or there's not a drop-in. So then they come over here and say, well, we'll just go to Hastings and wait in the emergency room. And nobody wants us using our emergency room dollars by any means to see an earache. But that's what my people are doing over there. And it's overcrowding Hastings. And I hate it because we're using expensive dollars to see things that are not emergencies.
Yes, Councilman Knight.
And you brought up the after hours, and I can ask one more question, Madam Chair. We know what after hours works real good, by the way, it does work good. One of the complaints I get is, at whatever time you start calling in, whether it's 7:30, I don't know what time it is, but 5 minutes later, all the appointments are filled up. And so, my people are wondering, how do you fill up? How many appointments do we have after hours at NOAA? I guess is the question.
They see patients, they book them until 6. I'll have to clarify, I don't want to
But
misspeak.
is it like 5 or 25 or?
Well, the way our schedule's working, all the clinics, they have 3 slots per hour, 3 20-minute slots per hour. So in a 12-hour day, you're gonna have that many slots. So
So from like 4 to 6,
you're gonna have 3 slots per hour.
that's 6 slots. That's why they give us a split. So we're back to we need some more positions or nurse practitioners or something.
Nomination vote.
Anyone else have any questions or comments?
Madam Chair,
Yes.
on appointments like we talked, I think it's 2 or 3 weeks ago, in our planning group there for Hastings Hospital, talking about a certain percentage of patients that cancel their appointments. Was that number like 20, 25%?
It's in surgery, the surgery
Yeah, was
appointments.
that 25, is it about 25%?
Yeah.
That's high.
It is, because that means someone who needs that appointment
Sure.
missed out on the opportunity.
Yeah, and then we start running into the problem that then there's a backlog after that, that's just a domino effect. Is that, if you compare that to like Claremore or other health facilities, how do we rate there?
I don't know how it compares to Claremore, but private sector, I would say probably less than 3%.
Thank you, Madam Chair.
One of the things that I do see them do in the private sector is just make a call and remind them. A couple of days, I know the dentist, my dentist does that. And really that is a nice touch, because if they're not coming, you still got time to get somebody else in that appointment.
And we do that, and the problem is if they haven't given us a good number, then it may or may not work, and we may or may not know, so.
Please lie to you, they'll tell me that. I used to be one making the calls.
Well,
I
we
always
might,
appreciate your perspective.
it might cut down a little bit and then allow you to fill it with someone else as a backup.
We'll keep trying.
That is too high, and there probably needs to be some result if they don't show, and they don't give you any notice. At some point, you have to say, you lose your term. Unless there's a valid reason. I mean, I can understand maybe they didn't have a way. That's a lot of problem with our people is they don't, maybe they plan to have a way to get to their doctor's appointment, but maybe they don't. But if they just didn't want to get up that morning and go, there's got to be at some point we're going to say, well, we're going to have to skip you next time, or you're going to have to go back to the back of the line, or because I get several people by my office a week now that say, can you help me? And I send them to you all, where their needs just, they can't get in there fast enough. Some of them's having to wait a year, and they really need some care. And we've been fortunate, we've been able to get them in to get some help, but it's aggravating when somebody else doesn't take advantage of their appointment time. Now, I sit here and say that, and I think I had canceled my appointment last time, but I did call you.
Oh, that helps.
Yeah, I did call you. But I do wish that we could fill every one of those appointment times up with people, because that's just wasted time for our doctors.
I forgot to tell you, I was in Walmart the other day, and a man stopped me that was like 73 years old, and he'd been over to Hastings. He lives over here in y'all's district. And he stopped to tell me that he was over at Hastings and he'd had something done to him. And he said, I've had 4 visits over there, and he said that whole hospital from the time he stepped in, he said it didn't even matter if it was the janitor he talked to ask to get directions. He said everybody in there was so helpful and so worried about my health. He said, I just want you all to know that from the moment he reached the door, he said even the person that was emptying the trash can said, are you okay, sir? He said everybody was focused on my health.
Good.
So I was kind of glad to hear that.
Well, I do realize what happens when people don't show up for their appointments. And several years ago, when I first got on council, I picked up the paper, and this woman had written a letter, and she said, don't go to Redbird Smith Clinic, they treat you worse than a dog. And it was awful the way she ran us down. And our health director investigated. That lady had missed her appointment 12 times in 1 year, and she was griping about what she was going to have to go through to get reinstated back there. But people, they don't show up a lot of times, and then what the repercussion is, they give you all this bad publicity when they don't get the pay. But that was thoroughly investigated, and when I found out the health side of the story, I thought, I'm not going to jump to conclusions when I read something in the paper or when somebody calls me on the phone, because you don't know. And at that time, our policy was at Redbird Smith, if you notified Buddy Holt and his group in transportation a couple of 3 days ahead of time, they would try and make sure that you had a way to get there. And I know they transport a lot of people all the time, many as they can. It works both ways.
Yes.
Our patients have to cooperate with us too. Any other questions? Well, I think our health department's doing great. Okay, we can move on into all business. Discussion and possible action on the 5%. Councilor Light?
Yes, ma'am, I'd like to request to table that for 2 months, taking us into the January meeting.
Table for 2 months. Oh, and bring this back up in 2 months. In new business, I don't see that we have any pending. And, did we ever hear from Mr. Values?
They couldn't find him, so I don't think he's here.
But we've got his report.
Can we ask her a question about that for you,
Pardon?
You know anything about this report? The book at the bottom of the second page. The book funds on there. 298 is funded. 24 was denied. It's right up denied. The other 446 are deferred to your group.
No, that's independent funds. Does that make sense?
Well, it says under 1991.
The 146, the 142 cases?
No, the 446. No, the one that says number under Cherokee Nation. You see,
Yes, I see what you're talking about now. I'd have to ask George what that is.
it's Cherokee Nation.
That's not related to the meetings.
I didn't.
They might have been, since we're talking about, since they know what's kind of heading down the road, they might be tracking that on their own.
You know if it has to do with last month or this month?
I don't think. I've never worked, well, I mean, I never worked with Georgia on reporting today, so I don't know what that is.
September.
Oh, yeah, don't get early, so it's September's case.
I think we need to reconcile from the email you guys sent a couple weeks ago. I think we need to get with Mr. Valier and reconcile that because there's two different numbers being reported as far as what I would think that would be what we were considering for the 5%, but there's a discrepancy between that number and what Brett reports.
Yes.
So,
Well,
Yeah, could you keep it two different piles, the regular contract health, the third one, and then the 5%?
kind of,
Yeah, maybe could you keep them in two different?
yeah. And a lot of times the patient will show up as Cherokee in their system, but they're not Cherokee systems, and they're not in our system.
after we check it on the building.
Or sometimes what I find out more often is if somebody's, well, most recently never had Pawnee and they were 1-8 Cherokee, picked her up years ago, but in their system, because there were more Pawnee, they listed as Pawnee. So when I look into it, I type them in, I go, oh, they're actually Cherokee. I say update that in the registration. Next time you learn more, update that system and make sure they show you Cherokee, not Pawnee. That's one of those things. I don't know, I'll have to ask George about this.
Could you please?
Sure.
Okay, thank you.
Do we have any more questions or comments for him? If not, I entertain a motion for adjournment. We have a second. All in favor of adjourning, let it be known by saying aye. We're adjourned.